Welcome to the Health Update. I'm Madison Kasper. With me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is the rise in food recalls among the U.S. So, Dr. Raja, we've been hearing that this year is the highest food recalls since 2019. Why is that?
So in reality, the numbers may seem that way, where we're seeing a lot of food recalls in especially 2023 and 2024. But if you look at the overall numbers, we're not that far off from just pre-COVID days. We're kind of on par with what we used to normally see before COVID days. There are a couple of reasons, though, why we may be seeing increased food recalls. And one of the things could just be we are consuming more food that's coming from lots of different places. We're importing a lot of food. The second thing could be we're also consuming a lot more processed food. So how the food is prepared and how it shows up at our end has changed. And in general, these are some of the reasons why they think there may be an increased food recall. And the biggest of them all is we've probably gotten a lot better at screening and tracing of food recalls with better technology. So with that, we're probably just catching more of the things that we may never have caught before.
What symptoms should someone look for if they think that they've eaten a food that's been recalled?
Right. So the classic symptoms, if you end up consuming food that you think may have been contaminated in some form, would be abdominal cramps. You may get nausea. You may have vomiting, and maybe diarrhea as well. So if one of these symptoms could be an indication that maybe you ate something that was likely contaminated.
What is the most common health risk that's associated with food recalls?
So for a normal, healthy individual, if you end up consuming a food that has been recalled, you probably will have some kind of gastrointestinal trouble, and usually mild. But the problem is more in people who are the immunocompromised people, either young children or people who have some other condition or disease. In those people or in that population, the complications can be greater, and sometimes the unfortunate and really harsh complication and could end up being death.
So what steps should someone take to prevent these health risks?
Wash your hands well before you eat. Wash all the places where you put your food. A big plus, cook your food. Cook your food well. If there are pathogens that are causing this problem and the food is being recalled because of a microorganism's presence, if you cooked your food, it would go away, it would die. So the basic idea, so keep your hands clean, keep the area where you keep your food clean, and for the most part, cook your food before you consume it.
So how effective is the food recall system?
In reality, in the United States, it's very effective. In the US, they do a very good job of monitoring. The agencies that are out there do a good job of monitoring our food, catching things that may be problematic, and actually also reporting things that may be problematic. So to be fair, our food is actually quite safe to consume. Yes, we may be seeing increased numbers, but I see it as I think the system is working then. They're doing what they're supposed to do.
Any last thoughts?
So it is important to pay attention to what is the reason behind the recall. While foodborne illnesses and microorganisms are one of the reasons why food gets recalled, it's not always the only reason. So paying attention to that also matters.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.